What is MEN1? Multiple endocrine neoplasia type 1 is a hereditary condition associated with tumors of the endocrine glands. The most common tumors seen in MEN1 involve the parathyroid gland, islet cells of the pancreas, and pituitary gland. What is MEN2? Multiple endocrine neoplasia type 2 is a hereditary condition associated with three primary types of tumors: medullary thyroid cancer, parathyroid tumors, and pheochromocytoma. What are the components of MEN2A? Medullary thyroid carcinoma, pheochromocytoma, and hyperparathyroidism. What are the components of MEN2B? Mucosal neuromas, medullary thyroid carcinoma, marfanoid body habitus, and pheochromocytoma. What condition must be ruled out in patients with Zollinger-Ellison syndrome? Zollinger-Ellison is associated with MEN1, parathyroid, pancreas, pituitary. Why is surgery not often suggested for patients with Zollinger-Ellison who also have MEN1? Zollinger-Ellison associated with MEN1 is most often characterized by multifocal disease. It is difficult to surgically resect metastatic gastrinomas. FlashMed, video flashcards.